Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. Today there are no deaths related to COVID-19 to report. Current 5-day COVID-19 test positivity rate is 6.2% provincially and 5.8% in Winnipeg. 61 new cases of the virus have been identified as of 9:30 a.m. today. Yesterday, we announced that a female under the age of 10 died related to COVID-19. And this is another tragedy during this pandemic. And I'd like to extend my condolences to the family and loved ones. We're obviously going to protect the privacy of this individual and their family. And in keeping with prior announcements, we can confirm that there were underlying health conditions present, but we're not going to be sharing any more details related to this individual. And again, our condolences go out to their family and loved ones. Community Living Disability Services, day services, will be partially reopened effective today, Monday, June 28th. In addition to those participants previously attending day services, participants whose mental health has been affected by COVID-19 may now attend also. Participants, family members, or support workers are encouraged to contact their community service worker if they have any questions about the day services. Community Living Disability Services visitation restrictions have been eased for fully vaccinated participants who reside in residential care facilities. So effective last Friday, June 26th, fully immunized participants can have up to 2 fully immunized visitors visit them inside their residential care facility. Community Living Disability Services participants, their family members or support networks are encouraged to contact their community service worker if they have any questions about day services or visits related to fully immunized visitors. We've had some questions come up about museums, art galleries, and libraries and other related sites that weren't included in the current public health orders, and it's understandable. We've been at this for quite some time, and I think we've seen with each iteration of the orders, there are questions that arise about certain restrictions and other areas that have not yet been able to open or open to the capacity that people had hoped. Again, indoor gatherings are the highest risk, especially places where we have indoor gathering for prolonged periods. And so we're still at the early stages of this reopening plan. We're just days into our step 1 plan. So we're not in a position to open everything at once. We're certainly not out of the woods. We still see the virus here. We still see the effects of the virus in Manitoba. But we fully expect to be able to proceed with our reopen plans. Vaccine rates continue to climb. Our numbers continue to trend in the right direction. And so we fully expect to continue to be able to reopen things over this summer as outlined in our plan, but we're just not at that stage yet. So, we'll keep an eye on these numbers, keep an eye on those vaccine rates, and we can continue this reopen progress over time. So additional announcements will be made in the coming weeks as more and more Manitobans get those first and second doses. As of last Friday, all people age 12 and up are now eligible to receive the second dose. That second dose must be at least 28 days after your first dose, though. Individuals can book online at protectmb.ca, or you can call 1-844-MAN-VAC. So that's MAN-VACC. When people get vaccinated, the community spread diminishes. Protects not only themselves and their household members, but the people around them, our communities. It allows us to start our reopen plans. We were able to be on this our reopen plan ahead of schedule because Manitobans stepped up and got vaccinated. We can continue that progress. We can continue to be ahead of schedule if Manitobans continue to keep those vaccine rates going up, and if they continue to follow these public health restrictions that are in place. We're looking again for that one great summer. So do make that appointment today if you're, as soon as you're eligible. We're going to continue to see these restrictions lifted and getting back to more and more normalcy. So thanks, and happy to take some questions.
Thank you, Doctor. A reminder to our reporters on the line, you will have one preliminary and one follow-up question. Up first this afternoon from CHVN, Taylor.
Hi, good afternoon. How long will these different vaccinated and unvaccinated orders be in place? We've heard from folks who, want to get the vaccine but can't for medical reasons, who are, concerned that they won't be able to get up to as much this summer.
Yeah, so we're really planning to get to a place, a post-pandemic Manitoba, where we don't have public health restrictions. We have public health advice, but not restrictions. So we are traveling along that trajectory to get to a place like that. It's difficult to know when we will get to there. And so in the meantime, if we allow things to open for fully vaccinated people, we're going to be able to have more things open earlier. And so we want to and certainly encourage people who can get vaccinated to get vaccinated as soon as possible. And then we also want to take advantage of that protection and get things moving in this reopen plan sooner than we would if we couldn't take advantage of the vaccinated. So we are rolling towards a post-pandemic Manitoba, but we're not there yet.
Thanks. And last week, the Premier mentioned that early this week there would be an announcement for more abilities for fully vaccinated people. Do you have an idea of what this could look like?
We don't have any details necessarily on what we're going to be sharing at this point. We're already aware of those advantages, the not being required to self-isolate upon return to the province from domestic travel, visitation in healthcare facilities, dining indoor with other fully vaccinated people at restaurants. So we're going to continue to look at things again if we take advantage of the fully vaccinated individuals, the protection that we know that vaccine provides. We can do more earlier. It doesn't mean that's what's going to be in Manitoba for a long period of time. But it does allow us until we reach that post-pandemic Manitoba to be able to do more.
From the Winnipeg Free Press, Danielle.
Hi, Dr. Roussin. Do you expect to see more severe outcomes among children until they can also be vaccinated, or perhaps due to the threat of variants of concern?
So typically severe outcomes have been quite rare, thankfully, in younger children. And so at this point, we're not expecting to see an increase in the severe outcomes. We know that the virus can change over time, and so we're constantly surveilling that. But thankfully, severe outcomes have been quite rare in the younger children.
Okay, thank you. And on a different subject, the latest report from the province shows COVID cases with 50 to 120 close contacts. With that level of interaction, where do you see the COVID trajectory going in the coming weeks? And do you think it might be possible to see a stretch of days with 0 cases as we did last summer?
Yeah, so if we look at the whole purpose of the public health restrictions all along have been to decrease the amount of contacts. And so we know that the more contacts that a case has inadvertently will increase the amount of transmission. So the whole purpose of those orders were to reduce the amount of contacts outside of household. And we know that as we loosen restrictions, we increase those amount of contacts. So we still need Manitobans to follow by these current public health orders. We still need them to be well aware of COVID, that COVID's still in our province. We're still seeing transmission. We're still reporting cases. We're still, unfortunately, reporting severe outcomes. We still have people in hospital. So we still need to focus on reducing those amount of contacts as much as we can. If we see significant increases in the amount of contacts we have overall, then yes, we are at risk of seeing increased amount of cases.
From Global News, Joe.
afternoon, Dr. Roussin. So last week, the Public Health Agency of Canada released guidelines on what vaccinated and unvaccinated people can and can't do. And it says fully vaccinated people can do a number of things that we can't do in Manitoba. And it appears to have a lot of people frustrated and confused. So what's the message to people feeling that way?
Yeah, and so certainly Manitoba had input when we're developing messaging like that. I think the messaging like that is welcomed. I think it's it acknowledges the benefit of being vaccinated. But the caveat to all that messaging is that it has to occur within the framework of the public health orders within that jurisdiction. Manitoba was late to the third wave, so we're a bit later coming out of the third wave. So one of the recommendations, fully vaccinated people can be close to each other fully vaccinated people without a mask. And certainly that is the message. But right now, you still have to follow where that can occur. So, in outdoor public places, outdoor private places within the group sizes, we don't really have the indoor gathering allowed at this point. And we're just days into our step one. And that's just the trajectory of the third wave that hit us. So we're going to be able to do more and more of that. But the message behind that is fully vaccinated people are able to do more safely. And we support that messaging, but we still have to consider where we are in our trajectory right now, which is improving.
Thank you. And I know you mentioned earlier that the province is working on some future rules. But can you give us an idea of when we can expect to see more details released for fully vaccinated people?
I don't have a specific date or timeline on that. I think the messaging is clear of what we've done so far is that the way out of this pandemic is being fully vaccinated. And so we already are seeing benefits of that, both at the population level and then now at the individual level. So we want to encourage Manitobans to get vaccinated as soon as possible, and we want to support that decision by being able to show we can do more by being vaccinated. But a specific time frame I don't have at this point.
From the Brandon Sun, Kimberly.
Good afternoon, Dr. Roussin. This weekend I was at Riding Mountain, Clear Lake, and it was packed. And people aren't masking up, generally speaking. I saw very few masks. Staff at Riding Mountain were wearing their masks, but it was packed. And my question to you is, it just looks like people are letting their guard down. And how is this going to impact the future public health restrictions and a potential fourth wave?
So, like we've been mentioning, we're certainly not out of the woods. We were in a place to move to that step one. And you can see that the step one still has numerous restrictions, still fairly tight restrictions, because we're not out of the woods yet. If we start losing sight of this virus and dramatically increasing the amount of contacts we have, then we're certainly at risk of seeing a resurgence of cases. So it's those fundamentals again. So the restrictions have been loosened, and allowing us to do more, allowing us to enjoy a lot of this Manitoba summer, but we still have to be mindful of this virus. So the group sizes, they still need to be within those orders. So if it's public gatherings, it's 25, but you should still be trying to be maintaining some distance in those groups. If you can't maintain distance, then I would suggest wearing that mask, and then obviously staying home when you're ill. So there's a lot of things we can do and loosen these restrictions and get more and more enjoyment out of this summer. But at the same time, we can stay mindful of this virus because we do not want to turn around our progress at this point.
Thank you. My second question is, do you have a message for parents who may be a little nervous about this recent death of this young child? Do you have any words of reassurance for them?
Well, I think we should all, focus on that was a tragic day in Manitoba, and very sad to see that occur. Just yet another tragedy during this pandemic. And it's, it's that reminder that this virus is here, that we still have to be mindful of it. When we get vaccinated, we protect people who can't get vaccinated, and that's those younger age groups right now. But, as we say, this was a tragic event, but thankfully, it's, severe outcomes in children have been very, very rare during this pandemic. And so we know vaccinating all those who are eligible will protect them, but also that, up to this point, they've been at a significantly decreased risk of severe outcomes.
From CJOB, Rosanna.
Hi, Dr. Roussin. Thanks for taking our questions. With the decrease in cases, can you give us a sense of whether we're close to getting a handle on where the virus is spreading?
Well, I think that we've, as transmission decreases, then it's, we can find more and more specific areas of where it's being transmitted. Things haven't really changed for us at this point. We see a lot of household transmission. We see transmission at social gatherings and then transmission at certain workplaces as well. And so overall, those numbers in all those places have been diminishing. And then also we're seeing a diminishing amount of severe outcomes. So we're in the right trajectory, but we're not out of the woods. We're still quite active with contact tracing, contact and case isolation and follow-up, because our public health measures aren't simply public health restrictions. It's that case identification, the testing, to get tested as soon as you become ill, the isolation and the contact tracing, and then of course what's most important now is vaccine.
Thanks for that. So seeing as children under 12 could be a likely demographic where COVID can spread because they can't get vaccinated, what can you tell parents and guardians about protecting their children in terms of interacting with other children, those over 12 who are either unvaccinated, partially or fully vaccinated?
So I think it doesn't really change our messaging about the fundamentals. We're going to try to limit our contacts outside the household right now. When we do have contacts with people outside our household, we try to do it in lower risk settings, smaller group sizes, outdoors, still trying to maintain that distance whenever possible. And everyone who is eligible to get vaccinated as soon as possible. We know from the literature and what we see here that transmission amongst the younger children tends to be lower. And certainly severe outcomes amongst younger children are much lower than the rest of the population. So we want people to be vaccinated as soon as possible. We want everyone to practice those fundamentals. And we're going to continue to see these numbers come down, and we'll be able to move to the next phase of our reopen plans.
From the Winnipeg Sun, Scott.
Hi, good afternoon, Dr. Roussin. Last week, the Premier said he's willing to reopen if we hit our next target, beforehand. That could come as early as next week. Some of the projections are showing. You've said all along about needing at least one incubation period and ideally two before seeing the effects of reopening. Are you comfortable reopening potentially as soon as, maybe not next week, but the week after, into that second phase, if we hit those targets and our numbers continue to trend downward?
Yeah, so I think we've said all along that if we hit our targets early and all else being equal, then we could be at a stage to open earlier than planned. And so we did this with the step one, and it's looking like we're going to be able to do that with step two as well. Again, we're not going to rely solely on vaccine uptake. We do want to hit those targets. We need to hit those targets, but then we also have to see the numbers trending in the right direction. And then we do need a reasonable amount of time between the openings, and I would put that reasonable amount at least one incubation period. And so if we see that incubation period, we've hit our targets, our numbers still look good, then I do think we're in a position that we could consider a further reopen. But it's a number of variables there, Scott, that we look at. But I think there has to be a at least that one incubation period between reopenings.
Great, thank you for that. My second question revolves around outdoor sports. The cap on group, kind of sports games, stuff like that is 25 people. There's some sports, obviously, that have more people. Baseball, some teams have 15 to 20. It's forcing decisions from coaches and stuff like that to cut down to maybe 12, people to try and get under that. Will there be any changes to that, or is that just kind of the way it is at the moment? And like you said, kind of all along, you can't get to everything.
Yeah, so I think that we've significantly increased the outdoor group sizes to 25. We've allowed now organized activities to take place other than just not the tournaments where you're bringing a bunch of teams together. And so yeah, in certain circumstances, just like the rest of the orders, it requires some change to the usual processes. So there's unlikely to be a change to that prior to the next opening. But with the next opening, you could really expect that to expand.
From CBC Manitoba, Bart.
Hi, Dr. Roussin. Excuse me. I can assure you I don't have COVID. The daily test volumes are down in the mid-1500s. There's no more notification on your daily bulletin saying that if you should only get tested if you're symptomatic. So can anyone go get a COVID test now?
Well, I don't think anyone's going to be turned away from it. For the most part, our testing sites where we're looking for symptomatic people, as we're looking at the numbers coming down, then we have a lot of excess capacity for testing, but we still want to focus on the higher risk, the symptomatic people. At the same time, practicing the fundamentals and the usual public health orders that we have in place. But for right now, yeah, we wouldn't turn people away. But still, the suggestion is be tested if symptomatic. But even if you're not sure, very mild symptoms. We've seen COVID present with very, very mild symptoms: runny nose, scratchy throat, fatigue. One that's often missed is gastrointestinal symptoms. So diarrhea for over 24 hours is often missed. So we encourage people to be tested if you're unsure whether your symptoms could be related to COVID. But we're not really stressing the importance of asymptomatic testing just at the population level.
Okay, then, thanks. As of Saturday, there were officially 5 active Delta cases. C1617.2. Obviously, there's a lag there, and you've spoken frequently about the screening requirements and the sequencing requirements that make it a bit onerous to identify. But based on your modeling, what is the real prevalence or actual prevalence of Delta that you suspect is in the province right now?
Well, so we still expect it, as of right now, to not be a significant proportion of our cases. The alpha variant is still remains by far the predominant strain that we're seeing. The real issue is that we've seen in other jurisdictions that once that Delta variant is transmitting within your region, it will become the dominant strain at some point. So that's our concern. So right now we don't seem to see widespread transmission of this variant. We know from other jurisdictions that it certainly is a risk to that strain becoming the most prominent strain here. That's why we're stressing a fully vaccinated Manitoba. That's why we still have some public health restrictions in place, and we'll be loosening them cautiously over time.
From the Canadian Press, Steve.
Good afternoon, Dr. Roussin. I'd like to get back to what Danielle was asking earlier about contacts. Looking at the latest statistics in every health region last week, most people had 0 to very few contacts, but there were some in each health region with dozens of contacts. And I'm wondering if you can give us an indication as to whether these were generally workplace contacts, social contacts, or some other form.
Yeah, and so those are a mix, and all all along we've seen contacts within a workplace, within a household, within other social gatherings, and it's no different now. We're seeing that, and then we see a high range of contacts. Over time we've seen those number of contacts per case diminish, but we've always had sort of those ranges where we'd see an outlier and high number of contacts. So this is the concern. This is what the purpose of those public health restrictions have always been, is when somebody becomes a case, how many people had they inadvertently been in contact with, and if those numbers are low, we'll see case numbers come down. When they're high, on average, we'll see case numbers start climbing. Now, what offsets that is, what proportion of those contacts are fully vaccinated, and we're starting to see more and more of Manitobans be fully vaccinated. So, so we're going to have to watch this. But it's when we talked about our reopen plan, we still had those 2 requirements to get vaccinated, which we see Manitobans are doing, but we also need to follow those public health orders, which should diminish the amount of people who have those very high number of contacts.
And are you concerned when you see these outliers that have 30 or 40 contacts last week in different regions, and one case in the north there were 121 contacts, which appears to be a record during the entire pandemic for that health region?
Yeah, so I mean, this is a concern. This is the very reason we have public health orders in place. So I don't know the context of that. So again, it's not about trying to blame. They may well have been following the public health orders, and there might be some other circumstance with that. But if you look at people can be infectious for 2 days prior to being symptomatic. Because if we're following our advice, no one who's symptomatic should be having any contacts, because we've advised everyone not to be out and about when you're symptomatic. But yeah, when you look at all along, we've seen that roughly about 15% of contacts will turn to a case, and that varies depending on the setting. But the math is easy. The more contacts you have, the more transmission we'll see. And we'll see case numbers go up. So again, that message of, yes, we have some things that we've been able to open. We want Manitobans to enjoy that summer, but we can't lose sight of COVID. We can't lose sight of that Delta variant. We can't have that many contacts on average.
From CTV Winnipeg, Danton.
Good afternoon, Dr. Roussin. Okay, so you've spoken about the concerns with the Delta variant. We've heard similar concerns from other doctors who say that the Delta variant can possibly lead to a 4th wave. I guess here in Manitoba, is a 4th wave inevitable? What would that look like here in the province?
So I think we need to be prepared for a 4th wave. What that 4th wave looks like is difficult to know. I think we have our respiratory virus season approaching us, and we've seen a lack of other respiratory viruses this last season. We barely saw any influenza. We barely saw RSV. And I think that this fall we need to expect to see a resurgence of those alongside COVID and the Delta variant or another variant by that time. So we do need to be aware that a 4th wave, we're unsure of what it will look like, but a 4th wave will be coming. But we just need to be prepared again to be able to ensure we're not overwhelming our healthcare system. that Manitobans pay attention to those fundamentals. And by that time, the goal is to not have public health restrictions in place, but certainly public health advice that we're going to want Manitobans to follow. So, right now at this point, it's really important that we understand we're not out of the woods. We still see this virus. We still have that Delta virus here. We need to pay attention to this virus, but at the same time, we've put ourselves in a position to continue our reopen plans as per schedule, even ahead of schedule, because Manitobans have been getting out and vaccinated.
Okay, thank you for that. And you've mentioned a few times a post-pandemic Manitoba where there won't be restrictions, but rather guidance. Tough to say, but how far away is that post-pandemic Manitoba? Is that something that Manitobans can expect to see within the year, or is this something that Manitobans will see in coming years?
So I think the biggest message there is that a post-pandemic Manitoba is not a post-COVID Manitoba. We're going to see COVID cases. We're going to see COVID admissions to hospital and to ICU moving forward, but we're not going to be in a place where, the plan is to not be in a place where COVID by itself is threatening the healthcare system. So we have we had very little choice but to have public health restrictions, in play. But over time, as Manitobans get vaccinated, that is that goal, is to move away from public health restrictions, to get back to a sense of normalcy, and knowing that we're going to be living with COVID, like we live with influenza. And we're going to have to do whatever we can to protect ourselves from those viruses. But certainly the goal is to not have to do so through public health restrictions or very widespread public health restrictions.
Our final reporter this afternoon from City News, Mark.
Good afternoon. We're speaking with some parents who have kids under the age of 12 with pre-existing health conditions who are a little concerned. And I'm just wondering if there would be any advice right now that you might give to them. Would it be to keep their circles fully vaccinated for them and their kids right now? Just anything we'd say to the parents right now who are understandably concerned.
Yeah, and so this is a great question, because this is moving towards some of those the messaging we're talking about in a post-pandemic Manitoba, where Manitobans are going to be in a position where they need to assess their own individual risk for themselves or their families and make decisions based on their risk tolerance. And so people living with individuals that are at risk, that have underlying medical conditions, the number one message is to have as many people around them vaccinated as soon as possible. If the individual is high risk can receive vaccine, then obviously we want that individual vaccinated. There are certain populations within our within Manitoba that are unable to be vaccinated. Right now, that's those under 12. And so if those are high risk, then ensure everyone around them is fully vaccinated, decrease the amount of contacts outside the household, and practice those fundamentals. So in those situations, people are going to have to evaluate their own risk tolerance. There's various degrees of what are underlying conditions, so it's going to be different for different people. But the more and more Manitobans that get vaccinated, they protect those people who are unable to get vaccinated. So that's the real message.
Thank you. You had said earlier that people 12 and up can now go get vaccinated. I believe that is only the Pfizer shot for the under 18. Do we have any in Manitoba right now that we can still give to people under the age of 18?
So I don't have details exactly on the quantities of that. We know that there's appointments that have been booked. We've still allowing caregivers who had a previously booked Pfizer appointment to give that up to to a individual under 18 who has get the Pfizer, who have to get the Pfizer at this point. We're still hopeful that Moderna will be approved 12 and up in the near future. So at this point, if you're eligible for a vaccine, call and try to book an appointment.
Thank you, Doctor. This concludes our media briefing.